point. Number one, at the onset of the menstruation, our body goes through a lot of changes. At that time, we need to say what to do and what to not. First of all, breast cancer. Number one, breast cancer is very common. Half of the women died because of the breast cancer. At the age of 28, women should do self-examination of their breast. I mean, inspection, palpation, and check if there are any nipple discharge or not at the age of 28. If they feel any of the changes at the age of 30, they should go to they should visit to the doctor and go for mammogram. And the second disease is polycystic ovarian disease. In this disease, multiple cysts are developed within the ovaries, and it's a lifelong disease, and it really affects the quality of your life. What happened in this? Irregular periods, weight gain, hirsutism, muh pe baal aa jana, and acne. And it really affects the life of a girl, and it leads to infertility. Third is, and it's really very important to look, to see, to check. Third is pelvic inflammatory disease. In pelvic inflammatory disease, what happened is inflammation of uterus, tubes, and ovaries. What happened? Bacteria enter through the vagina, and it go into ascending order. It affects uterus, it affects tubes, and it affects ovaries. This usually happens after sexual activities. What happened in this? Patient usually remain asymptomatic. When symptoms come, it's abnormal discharge, unpleasant odor, gandi si smell wala discharge, heavy bleeding, pain in lower abdomen. If it remains pain if remains, should visit to a doctor. And this pelvic inflammatory disease also affect badly to the girl, badly to the patient, because it also leads into infertility cases. So eventually we should look for these diseases, we should look for ourselves. The fourth one is endometriosis. Endometriosis, what happens is our uterus is covered by a lining. That lining develop, and out of the uterus we say this is endometriosis. In this endometriosis, patient again feel pain in lower abdomen, heavy bleeding, and if chronic pain remains, she has to see the doctor, to visit the doctor, and doctor will give the treatment according to the patient need, either the medication or either the surgical intervention, whatever they needed. So last and fifth one is HPV, human papilloma virus. In human papilloma virus, this usually done after sexual activity. This may remain without patient virus come and virus go, and